So let me welcome up Dr. Michael Ocana, who is the head of psychiatry for EntheoTech. He's going to be sharing more about an approach that he's innovated called the Odyssey Method, which is proving very effective for treating chronic pain and depression. Thank you.
So I'm going to tell you a little bit about who I am if I can get this thing to work. I'm Michael Ocana. I'm the head of psychiatry here for EntheoTech. My background is as a psychiatrist, and I've worked in the hospital for 20 years before a change of careers here, and have worked in the emergency department. I also was the head of the adolescent psychiatry unit at Kelowna General Hospital and worked on all the different wards, but often pediatrics and so on. So pretty familiar with all the areas of mental health out there. I'm a clinical assistant professor at UBC and work with medical students. And my interest over time has developed around trauma. Really, that's been my kind of focus. I've done a lot of training in different types of psychotherapy. So I'm trained in this thing called somatic experiencing, which is an interesting type of treatment for trauma. Lots of different types. I could name them, but that would be boring. So, but trauma was really my focus and interest. And after leaving the hospital, I ended up wondering what I'm going to do next. And I came across this field of psychedelics, which was just kind of, as you maybe all know, has been up and coming now for a little while. And so I ended up going to do training down through an institute in California, the California Institute for Integral Studies, and did a one-year training there in psychedelic assisted psychotherapy. And then I met these wonderful people, which is kind of like a weird coincidence, but coincidences are interesting, so they're not always what you think they are. So that's something you'll learn as you get into the area of altered states of consciousness. So the Odyssey Method is basically what this is psychedelic assisted therapy, okay? A lot of you have heard of ketamine therapy, and you've heard of ketamine clinics. And many ketamine clinics and all the great research you've heard already tonight don't include psychotherapy at all. So what we've learned about ketamine is that ketamine kind of works as an antidepressant if you just run it in a certain way and you don't necessarily have to talk to people. And it's still an antidepressant, and it does all the cool things that you've just heard in the brain. But I'll be talking a little bit over tonight about why that's really just not good enough. Okay, so the Odyssey Method, which is just the name for this. Why did we call it that? Because we need to name it something. And the Odyssey is just a really interesting myth. Odysseus is just this really interesting guy who fought in the war and had to find his way home to his wife Penelope. In a way, it's the journey home to our heart and soul, which often feels like we've gotten disconnected from over the course of depression and whatever else we've been through. So this method, put together, and we're kind of all our clinicians are sort of working collaboratively in, is grounded in transpersonal psychology, which is a form of psychology which understands altered states of consciousness. You've heard them referred to a few times tonight as emergence syndrome and psychomimetic side effects. Okay? But in psychedelic therapy, that's not what we call them. We call them changes in the state of consciousness, like psychedelic states of consciousness. Sometimes they're called entheogenic states of consciousness. There's lots of really fun words for them. But in transpersonal psychology, we understand that by changing consciousness, we can change ourselves and heal. Okay? And this particular method is using my background in trauma-informed therapy, so all our clinicians are really skilled in understanding how trauma affects the nervous system and how trauma actually affects all those things in your brain you just heard about, the hippocampus, all the medial temporal cortex, and all these things. And so if we really understand trauma, we can support people to feel safe. And one of the most important things about psychedelic therapy when it works well is when people feel safe. You've heard of set and setting. Set and setting means that you feel safe where you are and that you have people around you that are helping you and supporting you to feel safe, which is why we don't recommend just taking this at home, in the basement with your friends or whatever. This is a treatment, a therapy to context. Okay? And this method also includes during the period of time, and I'll talk about how it works and how long and all that stuff as we go along, we're going to be learning other things as well than the medicine for changing consciousness, mindfulness, breath work, and mindful movement. So that unlike just running you through the ketamine clinic, you have now these ways to kind of continue to bring yourself back to yourself along the way if you get disconnected in the future. All right, I'm going to go through this fairly quickly because your brains are tired. But basically, cognitive behavior therapy is already out there. It takes a long time to start. There's a fair amount of relapse within 2 years. And the dropout rates are pretty high. Next slide. SSRIs have been around for a long time. They take a long time to get going. In 8 weeks, only this number of people have fully remitted from depression, which is not super high and impressive. And the 1-year relapse rate on fluoxetine is pretty high. Next slide. You can put them together, and that's somewhat better. It is somewhat better. I didn't put that up there. But follow-ups, pretty high. This is the most recent follow-up study here, and it's a pretty high relapse rate over the course of the next 3 years. Oh, God. All right. Well, but this is basically telling you is that ketamine, if you just run it in the clinic, look, in hours, that solid line is the people who responded. In hours, when they respond in hours, and that's not weeks like SSRIs. Next slide. Okay, now this is an interesting guy, but the point of putting him up there is to say, how did I figure out what was going on with ketamine? Because you've heard all about ketamine, and I was reading about it in the journals, and I'm like, this is great, we have a new antidepressant, but how is this working? Because it's not like any of the other ones, and it's an anesthetic, so what are we doing? Are we just numbing people out? But then why would they stay feeling better for days and weeks afterwards? So I looked up the research, and I found a bunch of papers by this guy. It's actually one big paper on 10 years of work with ketamine in Russia. It was in the 80s. I don't know, somehow they continued doing the work after the ban on, in Russia, I guess they could get away with it, maybe. Not sure. But anyway, he published this in the 90s. It was based on 10 years of work with addiction, so alcohol disorder, with using ketamine as the treatment. But when I read through it, he was doing psychedelic assisted therapy. And so he was using the medicine not to minimize side effects of psychedelics, like the ketamine clinics do, but using the ketamine to optimize the psychedelic experience and supporting people through it. And I was just fascinated by that. That's how I got into this. So next slide. Okay, now this is your brain on ketamine. Okay, and so you see up there, global-based connectivity. That's the snow globe effect that you saw. And that's how the brain lights up because it's talking to all the different parts, okay? And so 5 minutes in with ketamine, just regular dose ketamine, and 45 minutes in, you see the brain's lighting up and it's connecting up all these areas of your brain that don't normally connect to each other, okay? And that's what changes consciousness. Next slide. And here you can see that much not like what you think at the beginning where they're like, oh, we got to stop these psychomimetic side effects and hallucinations. They're too scary. Well, actually, the spiritual experiences with ketamine, the ones who had more of them, which are the dots that are higher up, had higher treatment responses, okay? So percentage change, that's how much your depression score changed. So the more it is, the more your depression score changed. So the more spiritual experiences you have actually correlates with more depression getting better, more improvement in your depression, okay? So it's not a side effect, it is correlated with the effect. So next slide. So how might that be? Why would having these things happen to your brain might maybe help you with depression? Well, let's look at it. This comes from a guy, Ron Siegel, who does a lot of work with mindfulness and psychedelics. And both of these things can change these areas of how our brain works. So here we have avoidance, emotional avoidance. In depression, we just want to avoid everything, right? We just want to hide in our room. Everything's too much. And we certainly don't want to think about it. We sometimes don't want to talk about it. Often we don't want to talk about it because it's upsetting. And so we'd rather not talk about it. But in the end, that doesn't work, right? So avoiding our emotional experience, okay, that when we change the brain, it allows emotional things that we've been running away from to show up. Now, that can be a little upsetting, but the medicines really help us with that. And the safety and the setting and the clinicians right there with you help you be with what you've been trying to run away from but not getting away from, but not alone and feeling safe And that can really reverse and change what's underneath depression in a really safe way and in a quick way, because just talking about it in an office, by the time you get to it, you only have a few seconds really there with it, and then you have to kind of wrap up for the next session. But here you're in the experience with somebody really safe right with you. The other thing here, rumination, so dwelling on past, anxious, and future things. That's just another part of our brain called the central executive network that just analyzes things so it can help you be a good executive, learn from the past, and plan for the future. In depression, that takes over your life. All you do is think about the past and agonize about the future. You can't stop dwelling on the past, and you can't stop worrying about the future. And in these experiences you get out of that, it changes the connections between your emotional centers and your planning centers so that you're not, you kind of break free of this experience. You get a break from it. People talk about like a holiday from this trap that their brain was in. And the other thing is the sense of self, the default mode network Francois was talking about, is this part of your brain that just thinks about who you are all the time. It's like, are people looking at me right now? Like, who am I? Like, is my shirt okay? Like, what's going on here? Like, and how am I insufficient? In depression, that's what we think. I'm just not good enough. I'm not making people happy. I can't smile anymore. Nobody likes me because I'm always miserable. Depression just keeps me in this vice grip, and I can't stop thinking about my self-image. And when we go into a ketamine experience, that dissolves. It's a very strange experience. It doesn't happen ordinarily. And we really need to prepare people for that if we're going to really invite them into the experience. If you just give it to somebody at a dose that does that without really explaining it to them, they can really get scared that they're falling apart, and they've never been outside of themselves. How many of you have been outside of yourself? Maybe some, okay? But most of us just spend all our time here. And being actually outside of that is very strange, but it can be very relieving and can be very healing. So let's go to the next slide. So let's talk about this method, okay? And it's very straightforward psychedelic assisted psychotherapy, so it's not something radically new or anything, but we're trying to integrate some pieces that aren't part of every single psychedelic assisted therapy. Psychedelic assisted therapy is many things. The Odyssey Method focuses on certain things, and it's not just taking ketamine and doing psychotherapy. It's really focusing on the states of consciousness, so it's a psychedelic therapy. So we'll have a referral process, we have an intake, which makes sure, the initial interview makes sure that everybody's on target, that we're working within our scope, and our scope is working right now with treatment-resistant depression. We also cover all the different things that might be associated with that, trauma, substance use, pain. But we are focusing on depression as our main indication right now. Preparation involves what I just said earlier about getting people ready to let go and go with this medicine, not be scared, and preparing them that if you have some unusual experiences, because if you step outside of yourself, you're going to have unusual experiences. You're going to see things in a way we don't ordinarily see them. It can feel mystical. You can have hallucinations, which means you're hearing somebody talk to you, and who is that somebody? Could be a spirit, could be a god, could be who knows what. It's very interesting. I don't know how many people have had experiences like that, but they're very interesting. And they can be very educational and informative, and in fact, quite inspiring sometimes if you're properly prepared and then you didn't just kind of get blindsided by that. Okay, and then first session is, as you already heard, we don't need to go over it again in our beautiful clinic. And then the integration session is where we work with our specially trained therapist who knows their way around this territory and knows their way around trauma. And so helps you put it together, okay? Helps you integrate the experience into your life so it's not just an experience you had once and now you're just going to go on with your life. You're going to bring it in. You're going to see what really matters about that. What does that say about me? What does it say about something new I learned about myself? What does it say about something else I'm feeling again, and I can come back to and feel that again regularly using, and somewhere in here we have, I don't know where, but what we have is integration sessions where you're working with our specialists in mindfulness and breath work. And you come together in our program as a group for that if you can handle it. If you absolutely, some people just can't handle that, we can do that separately because that sometimes when they're coming into the program, being in a group is way too scary. But many people, we'll certainly encourage them to be there. If not, they can see it on video. And they learn these other techniques which also allow you to shift your consciousness. But we're doing it in the window of opportunity that ketamine opens up for you. Because what we know, even if you just run ketamine, is people feel better. And that all that neuroplasticity happens. And you can, now it makes sense what you're doing. Because if you're just depressed and you try to teach people mindfulness, often they're just like, I can't do this, it's too hard. I'm too depressed, I just can't do this. But this window of opportunity opens. And also it's kind of like you find the target. You know what you're shooting for because you've had these experiences. And now it's kind of like, oh, I know what I'm getting to. I'm getting to this state I was in. And now if I do this mindfulness exercise or I do this breath work, I can get there again. And now it's something I can take with me. Okay? So, I mean, this is the relapse rate. You know, we saw those beautiful slides about how quickly people get better, but if you don't do the therapy, people relapse relatively quickly. Okay, next slide. That's ketamine. And then this is looking at sertraline there, paroxetine. And what I really wanted to show here is, and Francois showed this 0.9. That's a really big number there for effect size. And that's when we do psychedelic assisted therapy. In this case, it's with MDMA for chronic treatment-resistant PTSD, which is a very severe condition. That's a really high response rate. And maintenance response 12 months after treatment, 70%. That's really impressive. These people have been ill for like 30 years, you know, often, you know, on average, I think it was 17 or 18 years. So people were really sick for a really long time. And they stay well without taking any more medicine. It was just those sessions, okay? So we're really hoping, you know, to really bring all these things together here with our program and deliver something that keeps people well. So thank you for your attention.